Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. Finding the silver lining when it comes to a cancer diagnosis is tough. For patients, it puts their body, mind, and spirit to the test. And Stephanie Jones was no different. But she knew the challenge ahead and decided to get in front of it.
Come on, Gemma. Come on, Gemma.
Stephanie Jones has always had a thing for nature. It surrounds her here on her property in Eudora, Kansas. But for Stephanie, things look different now.
Whether it's a roly-poly on the ground or butterflies or a bird, I love a good stick because I see the potential in those.
A life-changing diagnosis came in 2021.
They found lesions on my hip area as well as on my skull. That's why I was diagnosed with multiple myeloma.
She would ultimately need a stem cell transplant.
I call it Transformation Day because it's the day that I gain new life. And I'm going to earn my wings just like a butterfly does.
She earned those wings, but her care didn't stop there.
I needed mental health care. I needed someone to help me on this journey.
This positive force knew her limits and knew she couldn't do it on her own.
The head trash that comes in, they always second guessing everything. The knowing that I will always be on chemo. I will always get shots in my abdomen. That's just the treatment. I'll always be on an oral chemotherapy.
And just like the treatment Stephanie received for her cancer, the care provided for her mental outlook is unique to the University of Kansas Cancer Center, including its name.
Our field is technically called onco-psychology, but when we're trying to appeal to patients to prioritize in their cancer onco care the psychological aspects, we decided that onco-psychology would be better named and better suited to reach more people.
And then Dr. Monks has been great with me. Finding joy, find something that, whether it's sewing, reading, whatever has brought you joy in the past, really connect with that. This is something that I desperately needed.
And she's connecting. She finds solace here in her she shed, hosting tea parties, doing crafts, and reconnecting with friends. COVID kept them away during treatment, and through it all, Stephanie shares this advice for others.
The chemo's part of the physical challenge. That's a difficult part on its own, but it's our mental health that we need to focus on, not only for ourselves, but our family and friends.
And we are so glad to have Stephanie Jones with us today in our studio, along with onco-psychologist Dr. Elizabeth Monks. Ladies, good to see you both.
Morning.
Good to see you, and glad you're here to share your story and tell us more and to share some of your insight. And you were diagnosed with multiple myeloma a year and a half ago. Let's just talk about the physical aspect. How are you physically doing?
Good. Today's a good day.
Today's a good day. And when you say that, we hear that a lot from people, taking it day by day. When you say today is a good day, what does that really mean to you?
I had treatment yesterday, and sometimes that can lag a little bit with more fatigue, but today's a great day, and I feel good today, really good. And every day is a different feeling going on this journey.
Well, a multiple myeloma, it's a cancer of the plasma cells inside your bone marrow. You had a stem cell transplant and the chemo that goes along with the transplant. Are you still going through other treatment? You said you had treatment yesterday.
Yes.
What other types of treatment and for how long?
I'm going through oral chemotherapy. I take a pill every day for 21 days is my cycle, and then I'm off a week. I do get Velcade shots in my abdomen. I get one injection every other week, and that is ongoing for life until they discover something newer and better to treat multiple myeloma with.
And no doubt they will.
Absolutely.
We're really focusing on mental health today as it pertains to cancer patients and people with these type of diagnosis. So Stephanie, just let's talk about how the diagnosis itself affected you emotionally and mentally.
It hit me like a ton of bricks. I had used to run marathons for Team in Training. I actually, 8 of my 12 marathons were raising funds for leukemia, the Leukemia and Lymphoma Society. So to hear that I was actually going through that journey of something that I had raised money for was hard.
It was a
very
full circle moment you did not really want to be a part of.
No,
correct?
No, I was happy to hear about the progress. I didn't need to experience it firsthand.
Exactly. And you were living life. You were actually, you had quite a TV career. Can you just quickly tell us about that? Because that's really exciting.
Yes, I was.
Or movie career, I should say.
I was traveling to Louisiana to work on some of the films down there. And that was really exciting, but of course that came to a halt because of everything I was going to be going through. So hope to pick up that one day.
You will. You'll be back. So then tell me about the emotional effect when it came to your treatment. That was how you were dealing with the shock of the diagnosis. Now you go through the treatment. How did your emotions and your mental health change through that?
I became more scientific. I had to keep on what pills I was on for when I was initially diagnosed because it was a specific thing, and that's not my way of thinking. And of course, my husband, I had to pull it all together because he was my caretaker. He's my caretaker, and I needed to be strong for him and leave the responsibility of taking care of the pills and things like that. But there were days when I would actually crash, and my head would swim with all what I call head trash. Every negative scenario would come into play, and that was great that they partnered me with Dr. Monks.
And Dr. Monks, is what you're hearing from Stephanie this morning similar to what you hear from other patients going through the same journey?
Absolutely. It's very, very similar. And there are some things that I think are unique, especially to multiple myeloma from a psychological standpoint, in that there's no cure, right? So when patients get diagnosed with this, I think it's extra scary to think, I'm going to do a stem cell transplant and that's going to knock this myeloma into as strong of a remission as possible, but then I'm going to be on treatment for life to keep it at bay. And like Stephanie said, there are new things, cutting edge things coming out all the time, so I anticipate that multiple myeloma will have a cure, and right now it seems more like it's managed like a chronic disease in some ways. But the psychological toll of that is is something that's very, I think, unique to our multiple myeloma patients.
You have to shift your hope into other ways, not looking for the cure or to be, no evidence of disease, but to be part of the process.
Right.
To be present in that. So you requested ahead of time. You kind of knew yourself well enough to know that you're going to need some help mentally down this road. How'd you know to do that?
It was nice because they gave me the option. They were my oncology team was like, do you need financial guidance? Do you need I knew we had that taken care of, but it was mental health. I said, I need someone to help me through this, because I had always relied on psychologists and different counselors all my life. But this was a whole nother adventure that I was going on, and I knew I needed an expert in that area. And that's where they got me partnered with Dr. Monks. And I was so grateful for that, because it's a whole nother challenge in my life. And also how I can work with it with my husband. Mm-hmm. Because I have meltdowns.
Yeah.
And he's there to try and pick up the pieces. But Dr. Monks helps me get a bigger process going to help me through it.
So Dr. Monks, your title is onco-psychologist. So what exactly is the role with patients? When are you brought in to their treatment plan?
The BMT team is special in some ways because we do a psychological pre-transplant evaluation for any patient that's going through an autologous stem cell transplant, an allogeneic stem cell transplant, or CAR T-cell therapy. And so we have a nice opportunity to meet patients up front. Mm-hmm. They're not necessarily asking for it, it's just part of the process. So it's a good chance to connect with patients who may not know to ask, who may not know that onco-psychology is even a thing. So we get introduced pretty early in the process and then have the ability to follow patients through, or have patients come back to us later. See patients in the hospital if they're admitted or going through things. So we get involved pretty early in the process, especially for our stem cell transplant patients.
Well, and you make a good point. It's a treatment option brought to them. Mm-hmm. Do you ever get pushback with people who just aren't quite ready because they're so focused on the physical aspect of this, making it through, surviving this, that we often put our mental health last? Mm-hmm. How do you walk people through that?
I ask patients oftentimes, because some people are caught off guard, like, why in the world do I have to see a psychologist?
Especially
what is this?
If you're not
I'm not crazy, I'm not,
Well, and you had mentioned, you said this is something you were used to in your world.
Yes.
A lot of people see therapists as just part of their regular maintenance of life and health overall. But for people who've never gone that could be kind of a a hard topic to talk about.
Yeah. For many people, it's their first interaction with a psychologist, which I feel like is a little bit of pressure to be like, let's make this a really good experience for them. But almost I can't think of a single patient that I've seen that does not agree that the process is just as much emotional, psychological, spiritual as it is physical. So that's a really great in, because most patients are like, yes, of course, I have good days, I have down days, there's ups and downs, there's fears. They naturally understand that it's a physical battle, but it's a psychological battle too. And some are just doing great and have excellent resilience, as all of our patients do. So the in is pretty easy, because most patients resonate with the fact that it's a mental battle and a physical battle.
Sure.
So,
and you've mentioned, we talked a little bit about it in the piece off the top of the program, and you've mentioned some things here now, but we talk about the uniqueness of the program here. What else? Tell us more about why it's unique.
So not every cancer center has access to psychologists that are trained to meet the needs of cancer patients. The fact that we're an NCI comprehensive designated cancer center, one of the requirements is that we have folks on board to meet those needs, which is very special. And we have a team that has specialty in BMT and hematological malignancies, which is a bit unique. I tell people sometimes I'm an onco-psychologist, but I'm a BMT psychologist, which is even more, I think, unique to have somebody who knows. I haven't walked in your shoes, but I understand what the shoes look like and just how complicated it can be. The treatments, the long recoveries, the stress of caregiving, all these things that are really unique. And we all do that for all of the cancers across the board. Try to have a deep understanding of each cancer and how it's unique, so that we can help patients psychologically navigate their individual processes and journeys.
So on that note, what specific types of tools that people may not know about, other than just kind of walking and talking and like you said, knowing what those shoes look like? What kind of tools are you giving patients like Stephanie and her husband to go home and really work through?
Right. It depends. It depends on the patient. There's lots of evidence-based approaches to treating things like anxiety and depression, and a lot of that has to do with changing how you think about things. We have very automatic ways of thinking about the world and seeing things that can contribute to worry or anxiety or low mood, and so there's great strategies to challenge the way you think, and not just, I always say I'm not all positive all the time, just because the reality for our patients is that it's not all positive all the time. But if you can achieve balance in your thinking, and be doing something that gets your mind off of cancer or reminds you that cancer isn't the only part of your identity. I think it can become all-consuming, appropriately so, but folks need to be engaged in things that also remind them that they're still who they are, and that cancer doesn't have to be at the forefront of their identity every second of every day.
Stephanie, I know you really wanted to try to use your story to reach people who might be going through the same thing or may not know that they will soon go through the same thing. So, help us kind of paint a picture of what a really bad day is, and then what a good day has looked like, and how you kind of navigate both.
Yes. Well, a really bad day is when I don't want to get off the sofa, and I rely on my dogs, my fur babies, to be there and support me. But a really good day is when we're out there, we're walking, we're going on long walks, and I'm in the she shed. I go out and escape to the she shed.
Oh, we're going to show video of that, because that was like epic. But
and I'm creating my favorite things. I'm working with seashells. I'm making cards for family and friends. I'm doing something that really brings me joy, of using that creative side instead of thinking of my cancer journey.
And you slow down. I know you've always been very mindful, and you're artistic, and you're really in the moment with the people you love, but has it even expanded more since this, and how so?
Absolutely. I think I have become more in the moment, even with our community, and making sure community knows that we have the Giving Garden, the Eudora Giving Garden on our property, where people can come out and walk, enjoy the flowers, and enjoy nature and the butterflies and things. All seasons. There's something to enjoy at all seasons.
Dr. Monks and I are going to have a girls' day date out there, right?
We're coming.
We're coming. Well, we were talking about that. I said, Stephanie is like that person you really wish you could be if you could just slow down and appreciate life day by day. So we're trying to lock in with you today. We appreciate that. Stephanie, is there one piece of advice that you remember or conversation that you remember with Dr. Monks that really resonated with you, that really maybe got you over a hump? Anything unique that you two shared together?
Yes, because I always always wanted to have my sparkle, and I feel as though my sparkle dulled for a while there, especially even before I went through BMT. And she told me it's still there. You just have to polish it up. And I think every day I make sure I polish it up so it's shining, so other people can see that sparkle in me.
Oh, polish the sparkle. Okay, I'm living with that. I love that. That's good stuff.
Everybody can do it, right?
That's really good stuff. Do you work with patients' families as well, their caregivers? And what are those conversations like?
I mean, every patient comes with their caregivers, their family, and that's a blessing in and of itself, because I shouldn't say every patient. Not every patient we encounter has great support, has supportive family. Family dynamics can be extremely complex, as we all know. And so we ask that the caregivers are often present at our evaluations. They are often present when patients are admitted in the hospital. We do some specific caregiving work for caregivers who are struggling maybe more than others, and we do a little bit of individual work with those as well. But a lot of times it just happens naturally because patients are bringing their loved ones and their caregivers with them, and it's a bit unique to psychology. The way we're trained is it's just like you and the patient. Once you enter the cancer world, it's like it could be you, the patient, their grandmother, their daughter, their significant other, their sister,
Lots
their
of
auntie,
dynamics.
like so many things.
Yeah.
So whoever's there is who we're working with.
So I want to take you into the world. When I went out to your home in Eudora, Stephanie, I pulled up and I said, I just want to spend time here. Tell us a little bit about your day-to-day. I know with your puppies and all the beautiful things that surround you out there and all the simple stuff.
Yes, all of our dogs are rescues. All of them are seniors. They have some sort of special need. So I guess in one way, they're helping me on my journey as well. And it's nature all around me. And I think that's what I love the most, because I've always loved nature. And it's been wonderful to be able to go outside again, because last summer I couldn't be outside. And so it's been nice to reacquaint myself with the swallowtail eggs, the monarch eggs, watching the caterpillars and seeing the transformation of the butterflies and thinking of my transformation that I just went through last year. And it's just a magical place.
Your gardens are gorgeous. You
Thank
said you said you look at sticks differently, rocks differently.
Yes.
Every little thing has life and beauty in it.
Yes, because you never know. That stick could become something in a fairy garden, or it could be part of a display in a wreath. You know, you can see the potential in everything.
It has a purpose.
And I think that's what cancer patients need to remember. There's potential in everything, no matter what our journey.
Okay, so we've talked about man caves. Everybody knows about the man cave, and then here comes the she shed, and the she shed puts all other she sheds to shame. Your husband built this for you.
Yes.
How important has it been? I mean, look at this. It looks like an old-timey little shop. I love it so much.
It's been everything, because it's where I've gone out to have tea parties with a friend, and then my husband. My sister came to visit, and we had a tea party out there. And so it really just envelopes love and my creation there. And it's just magic. And magic is created in there.
I love it. Thank you for taking me there. I didn't want to leave, as you probably saw.
Well, you're always welcome.
I know. I'm coming back. You know I am. Be sure to ask your questions today. Use the chat on YouTube or Facebook. You can tweet us or email the Medical News Network. The info is right there on your screen. Let's check in with Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control. How many COVID patients, Hawk, do we have right now?
Yeah. So, as of Tuesday, we are only reporting again once a week. As of Tuesday, we had 14 active patients in the hospitals, the same number as last week, and we'll see what the new numbers show next week as well.
So, Hawk, even if patients are not showing up at the hospital, we know that COVID is spreading in the community.
Yeah.
We see it in the numbers. Remind us, what does the CDC recommend if someone is exposed to COVID?
Yeah, I think it's a good time now to go back and rehash these. Again, these are recommendations put forth by the CDC. So we want to give the public what those recommendations are, because probably people have forgotten. They were last updated, I think, last August or even earlier than that. So if you have been exposed, now not if you're known infected, but if you have been exposed, you're supposed to mask for 10 days, keep wearing it for 10 days. Get tested after 5 days. You don't need to test immediately because it will take some time to develop some sort of viral load that you can actually test for and be able to identify. And then if it's negative, again, keep masking for that 10 days. If it's positive, obviously you have to isolate.
Okay, quick refresher. Talk more about what to do if you're feeling sick and you're worried that it might be COVID.
No, I think that's very important. So, okay, so we've gone away from not just exposure, now we're going away to symptoms or you are positive. So isolate at home, again, should be home for 5 days. And this is important for everybody who works. And I know it's difficult to miss work, but really you shouldn't be going to work if you're ill anyways, no matter what it's with. But be at home for at least 5 days, isolate at home. Obviously, get a COVID test. It's very important to test. We've had some questions. Do the at-home COVID tests identify the new variants? That is, the answer to that is yes, they do. But the recommendation is to test more than once. So you want to test probably over sequential days or every other day, at least 2 or 3 times. We know the sensitivity for these tests is about 75% up to 4 days after the symptoms start. So you probably, if you are negative on the first check the next day or the day after that, again with a home test. These home tests, these antigen tests, do identify even these new variants. So continue to stay home, again, for 5 days, isolate for 5 days, until you feel better. And then ultimately, if you are going back out in public, you want to continue to wear a mask for those 10 days. And it is, before you do go back out in public, you want to make sure that you are fever-free, and overall your symptoms are improving as well.
All right, Huck, thanks so much. Any reporter questions today? Let's get to our community questions if we can. Jean has a question, and Stephanie, do you take any type of anxiety medication or anything that helps with some of these mental health issues?
I have been on an antidepressant, but that's something I had been on before my diagnosis as well. I do have an anti-anxiety medicine. I don't usually go to that right away. I usually try to get myself at a place. If I'm home, I'll meditate. Nice. I'll just take a moment, do some deep breathing. When I'm out in public, which for me to go out in the world now is anxiety inducing. And so I usually step away, claim my space, and do my deep breathing exercises to balance me out.
Claim my space, another good word to live by. Dr. Monks, it's, again, I love when we have mental health focused programs because it's something we all have. Whether we're dealing with it or not is a different question, but we all have mental health to be tended to. And just to share that, I don't know if I know anybody who's not on some sort of anti-anxiety or anti-depression medication without cancer.
Right.
So it's important to be able to just talk about it openly, right?
Absolutely, absolutely. I often find myself saying, when patients are saying, what do you think about an antidepressant or a medication to help? Excuse me, as a psychologist, I'm not a prescriber, but I talk with patients about their medications all the time, and it's often our teams that are helping to prescribe and us that are monitoring how it's working. And I often say, I can't think of a better time. It's like maybe along with chemotherapy, we should be giving everybody an antidepressant or an anti-anxiety medication.
No better time.
Right, and so if it helps, I don't care if it's an anti-anxiety medication or a rabbit's foot in your purse or your favorite novel or whatever a deep breath, whatever helps you get through it. Do it.
Embrace it.
As long as it's not doing harm, right?
Exactly. Jeremy, on that similar note, Jeremy wants to know, what are some of the common steps that you take with new patients? He imagines it to be those first sessions could be tough. People still kind of in shock. It's very fresh. How do those sessions change from the beginning as you start to move down the road?
Yeah, I think the first thing you have to do is get to know the person that's sitting across from you, because I can't help you unless I know you. And so a lot of rapport building and relationship building, I think, is what happens in those first few sessions. And then you can get to know what kind of interventions are going to be helpful to that person, because some patients like Stephanie,
I was going to say, she's kind of the perfect patient.
She was already doing so much. I didn't have to teach Stephanie mindfulness practice. She already knew what that was. There are other patients who are like, what what's mindfulness? I've never heard of that before. And it's much more of a walking through of how to be present and why something like a mindfulness practice helps with anxiety or depression, or being able to cope or deal with whatever the circumstances are. So initially it's a lot of building a relationship, because essentially the foundation is the relationship to get change, to get folks to work on doing things a little bit differently than maybe they have before. You have to have a relationship to be able to do that. So initial sessions are usually about building that relationship and getting to know the patient.
Sherry wants to know, Stephanie, and you've mentioned a few things, but what's one of the most unique ways that you unplug and manage your emotional health? Anything, just kind of, what are some interesting ways that maybe someone can steal?
I think it's going out in nature.
Nature, that's your place.
That's my place, and walking and just enjoying. Of course, it's been very hot in our summer months, but it's been nice to go out in the mornings or late in the evenings. Like last night was a beautiful night to go out and stroll, because the temperatures were lower, and it's just nice to see the birds flying and just escape to that.
When I was at your home, there was a specific butterfly that was hanging around us, and you're like, that's the butterfly I know. He's always around here. So you're making friends out there. I love that. A couple more quick questions. Irene wants to know, do most insurance plans cover things like counseling for cancer patients?
Yeah, overwhelmingly so, yes.
Okay.
Most people's insurance plans have behavioral health coverage. It's also kind of nice. I don't know if nice is the right word, but because patients are spending so much money on their cancer treatment, their out-of-pockets are usually met lickety-split, so they're usually not paying a whole lot for our services, and we're often covered and included. So,
Dr. Hawkinson,
Yeah.
I have a quick question for you from Jean. How long after COVID, after exposure, do COVID symptoms start?
You know, that varies. We've heard anywhere from 2 to 3 days. It's probably more in that 2 to 4 day range. We've heard initially from 2 to 7 days. It's probably more in that 2 to 3 day range. Especially, we also have to factor in the fact that people have probably been vaccinated, boosted, and or infected before, so you already have some sort of immune response, and some of those symptoms are that immune response kicking in as well. So most people will probably have symptoms in that 2 to 3 day range, but in general, they do say anywhere from 2 to 7 days after exposure.
All right, and on that note, Hawk, stick with us. I want to get our takeaways today. Quick takeaway regarding COVID, and anything you want folks to know before we head to the weekend.
Yeah. Well, I think, again, we know the virus is circulating more out there, certainly higher than in the past couple months. I'm sure we all have friends or family who have said they either have symptoms or have tested positive. So it is vitally important to remember that it is circulating out there, especially now that kids are going back to school. It's really easy to spread from one person to another and bring it home, or vice versa, be out with friends and then bring it to school as well. So again, there are no mask mandates. There are no other rules for that, but you as an individual understand those situations that you're going into, and if you feel that you need to wear a mask, that is always okay to wear a mask. Remember to do frequent hand hygiene, either with the alcohol hand sanitizers or good hand washing with soap and water, and just understand what else, those other situations, if you're going inside versus outside, or there are going to be a lot of people versus no people, and that you can keep yourself safe, and those pillars of infection prevention follow with you wherever you go.
That's right. And a quick question from Catherine. Any word on a release date on the new COVID booster?
No. Unfortunately, it still looks like late September, early October now. I think they even said early October. We thought it was going to be late September. So unfortunately, no. We do know that Moderna did push out a press release saying that the new booster does have a beneficial effect and protection against the new variants, which that is expected. But also remember, as far as we're on topic with vaccines, the RSV vaccine is out there. If you are 60 or above, I would highly encourage you to get the RSV vaccine, because especially if you have contact with children, we know that, again, children can spread things amongst themselves, bring it home to grandparents, caregivers, what have you. Influenza vaccine will hopefully be available later this month as well. But for the COVID booster, we are hoping later this month in September rather than in early October, but no official date just yet.
All right, Huck, good stuff today. Thanks so much. Dr. Monks, what's the takeaway today?
Find a way to live your life. Our patients work so hard to have their lives and work against something that's threatening it. And so I think a big part of mental health is figuring out how, if you go through something that is traumatic and extremely challenging and probably some of the hardest stuff our patients will ever go through, when you come out on the other end, find your joy, find your meaning, your purpose, and you know, the sun peeks out even on the cloudiest and rainiest of days. Eventually the sun's going to come out, and sometimes you got to be looking for it.
That's right. Polish your sparkle.
Polish your sparkle.
That's right. Stephanie, what do you want folks to take away from your story?
I think that life is challenging, without a doubt. You don't have to have cancer to have a challenging moment in life. Get the mental health for yourself and for your loved ones. And never be ashamed of asking for help, because we all need it at some point.
We sure do. Great message. Thank you both for being here with us today. And thank you to our viewers for being with us and your great questions. Have a great weekend, and we'll see you back here on Monday.
Coming up Monday on the Morning Medical Update, imagine diagnosing your own cancer. That's how a young ultrasound tech discovered she had ovarian cancer. I'm Alexis Del Cid. On the next Morning Medical Update, she shares her story and the signs you need to look out for, Monday at 8 a.m.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.